Civil War Medicine by Ryan Loke and Maddie. What did they mainly focus on at medical universities? The first medical school in the U.S. was the University of Philadelphia. It was established in 1856 during the Civil War. At that time, only 800 people signed up.
The education level at the University of Philadelphia was really poor. Classes were usually taught with images of the battlefield. Classes were only 14 to 16 weeks long, and anyone can sign up for the university. The requirement for a graduate is minimal. Amputations during the Civil War. Any limb that was badly shot would be cut off. They were told to leave as much of the limb as possible, giving the patient the best chances of survival. It was not always necessary if the artery could be tied. Amputations were almost always performed if a large limb had severe punctual artery damage or nervous trunk damage. The two types of amputations were the flap method and the circular method. The flap method was widely used when time was a factor, using the skin to close the operation. The circular method was an incision in the skin, which means it would cut the muscle and then saw off the bone. Depending on the limb, the saw would change sizes.
Disease in the Civil War. Disease was a huge problem during the Civil War. It spread throughout army camps very easily. Little were known about how to cure these diseases, but the ways that they would use were very ineffective. For example, if you had a fever, they would give you painkillers and tell you to take a cold bath, thinking that cooling the outside of your body would cool the inside. For a cold, they would prescribe painkillers. Hospitals back in the Civil War created the organization for hospitals today. Hospitals in the Civil War were very unsanitary. They were taught that they had a shortage of water, so they should try to not wash their hands. Soldiers who were wounded were usually treated in field hospitals because most hospitals were too far away.
In conclusion, this knowledge is important because we know what they knew back then, and we know with the knowledge that they have and how much it changed. Not to forget that the procedures they used back then is almost simulating what we know now.